Hi, everyone, and welcome to our webinar today on the privacy of verbal communications in disenfranchised communities. My name is Matt Schwartz, and I'm the Privacy Fellowship Coordinator for the Innovators Network Foundation, and I'm going to be serving as the moderator for today's discussion. So for those of you who don't know, this panel is part of a series that we've been conducting on different issues that kind of fall under the DE&I umbrella. And so far we've held a two-part series where we discussed access to capital and the slew of issues that Black, Brown, Indigenous, and people of color face when trying to start a business. If you are interested in watching those, you can find an archive of both of those parts on the App Association's YouTube channel. And today we are discussing another incredibly important and timely issue. And I'm really excited to be joined by the amazing panel that we have here today. Just to set the scene a little bit, we thought this would be, an important topic to cover because it kind of seems to be one that gets a little overlooked in broader discussions about data privacy. We often talk about privacy breaches at the large social media platforms like Facebook, and those harms are very, very real and very scary. But our verbal communications in some ways kind of present an even more sensitive use case than kind of our web search histories or the dossiers that those companies hold on us. Our verbal communications are obviously us at sometimes our most unguarded. Sharing information with our loved ones or colleagues or even doctors, which has increasingly been the case during the pandemic. And if we can't feel safe in those situations, where can we really? So with that in mind, we are lucky to be joined with a wonderful panel who can help us fill us in on kind of how those who are often the most vulnerable in society can be uniquely harmed by invasions of privacy, and what that means and what we can do about it, if anything. So joining us today, and I'll have everyone introduce themselves a bit more in detail when we start the panel discussion, but we have Kentrell Owens, a PhD candidate of computer science and engineering at University of Washington, Lucy Ide, founder and CEO of Remedy, Lourdes Turrecha, the founder and CEO of The Rise of Privacy Tech, and Carlos Gutierrez, who is the Deputy Director and General Counsel of Lgbt Tech. So just to give you an outline on kind of the structure of today's webinar, we do have some time set ahead at the beginning for a fire starter discussion. So we're going to first hear from Kentrell on some very important research that he's conducted in this space and that we kind of hinted at in the invite materials for this webinar. And after that, we'll bring everyone back together for our moderated discussion. And then at the end, we'll leave 5 or 10 minutes or so, depending on how long we go with the conversation, for Q&A at the end of the session. So feel free to pop in any questions that you might have as they come to you. Don't feel like you need to save them for the end. So feel free to pop them in the Q&A portal at any time, and we will make sure to get to as many of them as we can at the end. So with that, Kentrell, let me kick it over to you to introduce yourself and talk us through your research.
Thank you, Matt. Thank you for the invitation from the App Association. Happy to be here with all the panelists. I'm excited for this conversation. I'm a second-year PhD student, as I mentioned, at the University of Washington, advised by Francie Rosen and Yoshi Kono. And I worked on this project that I'll be talking about today with Camille Cobb and Lorrie Cranor when I was getting my master's degree at Carnegie Mellon. And so today I'll talk about our work on surveillance of communication with incarcerated people. So to get started, the United States, as many of you might know, is at the top of the world in terms of incarceration, both in terms of incarceration rate and the total number of people incarcerated. And incarcerated people experience surveillance, right, when they're incarcerated, especially when using communication tools to talk to their family or friends. And prisons and jails around the US are increasingly using surveillance technology to monitor this communication. And although the described purpose of this surveillance is safety, as is the justification for most forms of surveillance, we need to consider its potential harms. So for example, incarcerated people reporting abuse to their families may result in retaliation. There are documented examples of this. Racism within the U.S. carceral system means there are disparities in terms of who is surveilled in the first place. And the families of incarcerated people have to undergo surveillance to communicate with them, so there's no real notion of consent. So to better understand this landscape, we interviewed family members of incarcerated people to understand how surveillance impacted them. So for some background on the prison telecom industry in the US, both in private and public carceral facilities, prison communication services are largely provided by private vendors. And this market is dominated by two major companies in the US. One of them is GTL Technologies, the other is Securus Technology, which is owned by a parent company called Inventive Technology, or Inventive, sorry, just by itself. And there are 5 primary methods for communicating with someone that's incarcerated. Phone calls, which is the most popular, physical mail, electronic messaging, also known as email, but very different than what we consider email. Video visitation, which is increasingly being used, especially during COVID, and in-person visitation. And the communication methods available at one specific facility vary widely, depending on your county, region, state. And some notable surveillance mechanisms that we detected in our research include geolocation of call recipients' phones after they answer the call. And so someone might, after you get a phone call, if you press accept, according to the privacy policy of one of the companies we looked into, they would track your location for an hour after you answer the phone. And this has been used by police in the past to bypass the warrant process for getting someone's location. Another surveillance mechanism directly related to the voice is voice prints. There's been a lot of organizing around this in New York City, but voice prints have been used as a biometric to track people and identify people when they're talking to incarcerated people. And an increasing number of facilities have banned physical mail altogether and use private companies to scan and index mail. So to understand how and if these surveillance mechanisms affected their communication, we interviewed 16 family members of people incarcerated in Pennsylvania. As you may know, Carnegie Mellon is in Pittsburgh in Allegheny County. So we found family members of incarcerated people around the Pittsburgh area. The interviews lasted for a max of 1 hour and compensation was $30. We interviewed people either on campus or at public libraries near them around the city at flexible times. We chose to interview families of incarcerated people rather than incarcerated people themselves for a couple of reasons. One is that if we talk directly to incarcerated people, our communication would have been surveilled itself during the interview process, which could bias what they say, but also introduce risk to them if they say the wrong thing. Recruitment, of course, would have been difficult, and there are lots of researched ethical challenges around consent and compensation when working with incarcerated people. And so when we talk to people, we ask them questions about their perceptions of how prison communication companies manage data collection, retention, and use, in addition to other general surveillance and privacy-related questions. So in terms of our findings, the people we interviewed believed that there were legal, practical, and technical barriers that limited the amount of surveillance they could experience. Although as we show in the paper, these barriers are either non-existent or have little impact. Participants thought it was unfair that they were surveilled because they're not themselves incarcerated. And some people thought their words collected during surveillance could be manipulated against them or their incarcerated relative. And people brought up their various privacy-preserving strategies, including using the most private communication method in their mind and straight-out self-censorship. And although this paper was focused on surveillance and privacy, in terms of the research questions we asked, our participants mentioned numerous other problems and challenges of attempting to stay in touch with their incarcerated relatives outside of surveillance, including cost, convenience, accessibility, and the prior experiences with prisons limiting the communication options they would use. So in our discussion section of the paper, we raise these implications of surveillance and its broader impact on incarceration. We argue that because people who are incarcerated are surveilled, and we know that your wealth affects your ability to bail out. If you can't bail out, you're more likely to be poor, low income. We argue that the fact that low-income people are staying in jail, even though they might not have been convicted, but their communication is increasingly surveilled, reinforces existing wealth disparities and racial disparities in the U.S. in terms of incarceration. We discuss better ways of communicating surveillance practices, risks, and legal rights to people. And we made an example flyer that we shared with some community organizations that work directly with family members of incarcerated people. And I think important future work in this area could explore the plethora of non-surveillance related concerns that people have about prison communication, although that was the focus of our study. If you get time, you can take a look at the full paper. It's called Surveillance of Communication with Incarcerated People. I also have a talk linked on our website, a longer version of the talk. But hopefully we'll get into a lot of that today on this panel. And I'm excited to converse more with other panelists and the moderator. Thanks.
Thanks so much, Kentrell. And if you want to drop in a link to the paper or any other work throughout, feel free to do that so our attendees can see. And yeah, so I think with that, we can kind of bring everyone back in and maybe run through the rest of our introductions here before we get into the moderated discussion portion. So if we want to go down the line here, Lucy's first on my list of boxes here. So why don't we start with you, Lucy?
Sure. Thanks, Matt, for having me today. So I'm Lucy Ide. I'm the founder and CEO of Remedy, which is a healthcare technology company. And I'm a physician by training. And our company builds software for healthcare providers. And we work with a lot of medically underserved communities, federally qualified health centers, and others. So I look forward to the discussion today.
Thanks. And then Carlos, you're next.
Hi, everyone. I'm very thrilled to be here. I'm Carlos Gutierrez. I am the Deputy Director and General Counsel for the LGBT Technology Partnership and Institute. We are a 501c3 organization that works at the intersection of LGBT and tech issues, dealing with data privacy and a lot of the other issues attendant to that.
Thanks, Carlos. Lourdes.
Thank you, Matt, and thank you, Kentrell, for presenting a summary of your research. I'm Lourdes Turrecha. I'm the founder of the Rise of Privacy Tech, which is the only community that brings together the key players in the emerging privacy tech space. So the founders, the domain experts, and the investors funding privacy tech. I'm looking forward to exploring some of the issues that affect communities of color and when it comes to not just communications tech, but other types of online services that may disproportionately impact such communities.
Thank you, Lourdes. And so, yeah, I think, now we can go ahead and jump into discussion, and maybe a good place to start would be just with some reactions to what everyone heard from Kentrell and his research. From my perspective, I think a key point to pick up on from what he described is just this situation in which an individual's privacy is invaded with kind of very little transparency available for the affected individuals to kind of even understand what is happening behind these technological systems that they're reliant on to speak with their loved ones, let alone even contest it. So I think, an important consideration here is that often folks, it's often folks from the most marginalized communities who kind of have the least amount of time and the least amount of resources to look into these issues, because systemically there's just so much else to contend with from their perspective. So, I guess my first question from the group would be, why is that so concerning, and how does the lack of transparency a hindrance to folks raising the alarm? Lourdes, I know that you've mentioned that you worked on similar issues before, so maybe in the prison communication space. So maybe we can start with you.
Yeah, so the way I've looked at it was through the lens of obviously the incarcerated, and we know that they have very limited privacy rights in the United States. And I'm really glad that Kentrell and Lorrie looked at the other side of it, because it's not just the incarcerated whose privacy rights are breached or invaded when it comes to these communications platforms. There are other individuals whose rights are also impacted, and it's such great research that you guys are presenting to highlight the other side of this, folks who deserve their privacy rights to be protected. Just because they have loved ones who are incarcerated doesn't mean that they also give up their own privacy rights when it comes to using these comms platform. But I think it goes beyond that. Even in the outside world, we see a lot of these communications platforms and apps in general, online services in general, disproportionately affect people of color. I mean, they already have many of these systems already invade individual privacy, but there was research presented at the FTC Dark Patterns workshop that showed that people who are lower in income brackets, which is a proxy for race, and people of color who speak English as a second language, who have less digital literacy, all were disproportionately affected by dark patterns, which are often deployed when it comes to launching some of these products, these comms apps. For instance, like Clubhouse, there was, the privacy community came out and raised a lot of privacy protest when it came to how they launched their voice social media app, and pointed out the dark patterns that came with it when they launched it.
Yeah, that's a great point. Thanks for sharing your previous work on that, Lourdes. Kentrell, I'm interested in kind of this perspectives of the folks that you interviewed for the study. Did the people you interview kind of mention anything about the powerlessness that they felt in the face of these systems, and in the face of kind of the prison industrial complex, and did they voice anything about their ability to change things, or was that not even kind of like a top concern for them just because of everything else going on in their lives?
Yeah, thank you, Lourdes, for hearing about your research. I want to ask more about it. But the people we interviewed, yeah, definitely, we asked them a question explicitly about whether they felt they had any agency to change some of this stuff. Yeah, and like you might anticipate, the consensus was no. They mentioned explicitly prioritizing like keeping in touch with their loved one. In some instances, they did limit the communication method they use from one to another. So, for example, we interviewed some people who we realized that happened to be previously incarcerated themselves, that had family members incarcerated. So they didn't feel comfortable going back to the facility in person to visit because of their experiences there before. So they tended to use more digital tools, which in turn can lead to more surveillance because of being forced to use those tools. This also happened during the pandemic, where people who might visit in person had to switch to using video or phone tools, leading to more forms of surveillance. Whereas, if you're in person sitting next to each other, you might have a conversation that can have some privacy because there's a lot of other people sitting next to each other. So you have some reasonable guarantees about the confidentiality of the conversation. But COVID sort of sped up this digitalization of prison communication, including mail. There's a lot of mail scanning happening now that started during COVID. But yeah, they felt, I think, powerless, although they did make decisions about what communication methods they use.
Yeah, absolutely. That was kind of the other main thing that struck me about the research, is just kind of, even without having the full transparency into the technical specs or what these companies were really doing, and not really looking at their privacy policies, I think people, they seem to have a pretty good sense that the prison phone companies were not to be trusted, but they kind of had to use them anyways, because for some people that's the only way to stay in contact with their loved ones. And so, I know this might be a broad question and hard to answer, but can you kind of give us any background that you picked up from your research on how we got into this situation in the first place, and also maybe describe any sense of the impact that you got from the families that you spoke with about what the situation kind of made them feel like?
Yeah, that's a tough one. I think there's broadly just this increasing use of technology in different public sectors, but in the prison context, as I mentioned, one obvious example of this is mail. So Pennsylvania was the first state to start digitally scanning all mail in 2019. And they did it as sort of emergency contract process. There's no formal, request for proposal, no time for public feedback. It was all done very quickly. But since they did that and set that precedent, Florida is now moving to banning physical mail and only letting people view digital forms at like a kiosk or on a tablet they have. The Federal Bureau of Prisons is also moving that way. And they're doing a few pilot studies, but haven't formally rolled it out yet. So I think it really just takes one facility to introduce some new digital surveillance practices, and then irrespective of the efficacy. So for example, this Pennsylvania mail scanning program they're running now, the purpose of it was to reduce drug contraband into Pennsylvania state prisons. And the random drug test positivity rate before this program was 0.7%. After 6 months after they implemented this program, the random drug test positivity rate was 0.6%, right? So they spent $5 million, it's some $1 million annually to do this mail scanning program to reduce drug intake, but it hasn't significantly affected the positivity rate. That doesn't appear to be stopping it from spreading or stopping its usage at the facility.
Yeah, that's a really good point. We often think about the ethical elements of all this stuff first, but there's also the efficacy question of is the surveillance actually achieving its intended goal? And I think the more that you have a nebulously defined project, the more likely you're not to see return on your investment in that way. I want to turn to Lourdes. You kind of also recently did a deep dive on some troubling privacy practices at a company with your Clubhouse piece. Can you maybe talk a little bit about that and talk a little bit about what that company does for people who might not be familiar at all with it, and what you found when you kind of took a deeper look under the hood?
Yeah, sure. I'm happy to. And I'll share a link to the series in the chat in a few minutes. So earlier this year, last year during the pandemic, we saw the launch of a new social media platform. And this one, it was focused on voice. It was a voice social media platform. And, the downloads were just skyrocketing, but the privacy community was up in arms because, here we are again, another social media platform, and they haven't learned from all of the privacy fails that their predecessors have gone through, all the consent decrees with the FTC, the privacy invasions of consumers and users. And it was really interesting because, it was used a lot by during the national wave of Black Lives Matters protests. And so it was interesting that you see this privacy invasive app being used in all those rooms. And there were reports online where they said that there was police listening in to some of these conversations. And on the flip side of that, you see the increase in download of Signal, which is a more privacy protective app to put together to plan for these protests, as opposed to just jumping on a platform that has less privacy protections, that wasn't really designed with privacy in mind. So that's one specific use case of how I saw, the people of color, the Black community being disproportionately impacted by the lack of privacy controls that Clubhouse suffered when they launched without really designing the app with privacy in mind. But everyone was affected there, but it was one of those specific use cases, because when they launched it was really used heavily during the movement last year's national wave of protests. And a few months later, it was really interesting when the FTC then came out, and they have all these experts from Stanford, from Chicago. So they had folks like Stephanie Nguyen. They had Mutale Nkonde from the AI for the People, and who's also a fellow at Stanford, and Kelly Quinn from Chicago. And they reported, based on their research, what I mentioned earlier, which is that when it comes to these dark patterns, so Clubhouse was one of those apps that we pointed out deploy dark patterns during their launch. People of color really suffer disproportionately. Obviously, dark patterns target everyone, but people with lower incomes, people who speak English as a second language, and folks whose cultures aren't the dominant ones, folks with less digital literacy are disproportionately targeted or impacted when it comes to privacy invasive tools and dark patterns that are used by these tools.
Can you give, maybe if you remember, any examples of the types of dark patterns that Clubhouse was using? I know there was something there about
Sure.
them automatically getting access to people's contacts when that had been authorized by the user. Maybe that's not a perfect example of a dark pattern, but if there's anything else.
Sure. So when I'm not sure, I'm off Clubhouse now, so I don't know if they still have those. There have been reports that they fixed some of these things, but when they launched the app, I took some screenshots of their onboarding and how they would have. They basically designed it so you agreed, so you consented to the gathering of your contacts to accessing your social media accounts, your Twitter, and all of those things. I'll share a link to those screenshots that I had in the article. So those were some of the things. So dark patterns in general are just design choices that the apps or any online service makes when it comes to how they interact with you. And oftentimes they can be used to get you to give up more control over your data. They can also be used to get you to do repeat subscriptions. So they can be used for non-privacy reasons, but they're used quite a bit when it comes to these companies wanting to get you to quote unquote consent to the gathering of your personal data, which, I would argue that dark patterns don't really equal to consent, because you're basically tricking users when it comes to the quote unquote consent that you're getting from them.
Right, thanks. That's a good explanation. We're trying to be positive at the App Association. One thing that we've been a big proponent of is encryption. And Carlos, that's something that we've had you join us before to talk about in the past, is kind of this importance of elevating privacy enhancing technologies, specifically for the LGBT plus community. So maybe in somewhat of an analogous way to the folks from Kentrell's study, a lot of the people that you work with are kind of reliant on communications technology as well, either because they're physically distant from like-minded folks in their communities, or they feel they need to protect their identity in certain sensitive situations. And so, this often comes up in kind of the encryption debate, where we've seen some bad proposals from Congress that kind of seek to capitalize on sensitive issues like terrorism or child sexual abuse material in order to kind of create a wedge for more surveillance. But I think it's true even in just the context of the simple ability to have a private phone call. So maybe could you talk a little bit about what's at stake for the community that you represent, and why you guys are so strongly privacy?
Sure. First of all, I think that the research that Kentrell's work doing and the work that he's doing is very directly relevant to our community. It is a clear result of a number of research projects that LGBTQ plus people are overrepresented in every stage of the criminal justice system, starting at the juvenile criminal system. Queer women and trans women tend to get longer sentences. They get to be put into solitary confinement at a higher rate than other people. So the issues that Kentrell's talking about for the community is huge for our community, down to kind of anti-loitering laws in New York that are colloquially known as walking while trans, where they were used to harass trans women who are not sex workers, just on suspicion of being sex workers. So a lot of the surveillance techniques and a lot of the issues that have been raised are very directly related. And a lot of the concerns that we have around this is the lack of accountability. So when Kentrell starts talking about the voice calls, one of the issues that are coming up that we see is automated intelligence being used now to like scam phone calls of prisoners for certain keywords and for certain phrases in order to catch quote unquote, criminal acts. Well, who's designing these systems and who's putting in the inputs of what is considered flaggable words? These are, extremely troubling issues. Artificial intelligence is unaccountable in a lot of ways. These companies create these technologies in a black box. Nobody knows what inputs are being put into them. Nobody knows how the decisions are being made. And it's only after the fact that we find out how many of these systems are discriminatory. One good example of that is facial recognition systems, which have been, one of the issues that we deal with a lot is just kind of technology outracing regulation. And facial recognition is a perfect example of a technology that has been put out there, has been put into surveillance, has been actually, used by police departments and a whole bunch of other corporate people in order to catch and flag criminals. But we know that facial recognition systems are discriminatory. They have a very high error rate for minorities. A lot of these systems were based on binary builds, so men and women, and all of these systems do not capture non-binary individuals or trans individuals. So these systems on their own, without regulation, tend to have issues around accountability and also accuracy. But that has not slowed down kind of the deployment of these systems. So for LGBTQ communities, the work that Kentrell is doing is very on brand. And I think the danger for our communities that's elevated is that in addition to all of the other things that Kentrell's talking about, the sexual orientation is a factor that could put people at danger, not only in prison, but everywhere. So when we do data protection policy, when we talk about the importance of SOGI data, sexual orientation, gender identity data being protected, it's not only as a factor of privacy, but it's a factor of being fired. It's a factor of being thrown out of your home. In 69 countries around the world, it's a factor of being arrested or criminalized just for being LGBTQ+. So the stakes are really high for our privacy and our data. So all of this work and all of the surveillance and all of the protection data that we do, it's heightened for our community in the sense that the sexual orientation leaks can reveal a lot of information that can lead to consequences beyond the immediate data leak.
Totally, yeah, and I think that's why we are so big about talking about privacy enhancing technologies in Lourdes. That touches on a lot of your work as well. On the flip side of being a part-time investigator of bad app practices, you also kind of wear your other hat at the rise of privacy tech, where you're trying to kind of incentivize the exact opposite outcome, which is to try and generate and support business models that are inherently privacy protecting. Specifically kind of from a small business startup angle. So can you maybe talk a little bit about your work there and add any thoughts about why specifically you think that it's so important to get that work right, especially for BIPOC or LGBT plus communities?
Yeah, I think that what we find that when we talk to companies and to people who are doing this work is never really like there's never like a negative intent, right? It's just lack of awareness around a lot of these issues. So when I talk about how systems are built and on a non-binary, people are not aware that that's something that happened and how their AI is being used. A lot of the work that I've been encouraged to see that a lot of companies use is more inclusive work. They're pulling in organizations like Kentrell's and everyone else on this panel to talk about these issues beforehand. So if I go in and talk to you, we can talk about how you design gender, cues in apps. How do you design kind of the way you talk about gender identity? And I think these conversations are taking place earlier. And I think it's important for people who are doing work in these areas to talk to people outside of the tech space. The tech space still has an issue with marginalized communities. The tech space still has an issue with racial kind of makeup. So it's important for the tech space to reach outside of their own kind of bubble and talk to organizations that may not be tech, but may be able to bring an insight into their customers that they may not have brought otherwise. So the work that organizations that do civil rights work in this space do, and the way that companies reach out to organizations like ours is kind of the important groundwork, because it is important to get this right from the start and try to fix it later.
Totally agreed. Yeah, and Laura's just wanted to tee you up to talk about rise of privacy tech work in the space as well.
Yeah, absolutely. So the reason why we founded the Rise of Privacy Tech was, I got really sick of companies just wanting to do the bare minimum when it came to privacy. And we've seen how law and policy is always lagging behind tech. And I saw that there was this emerging space in tech called privacy tech, where a lot of folks want to solve for some of the privacy problems and address the mounting privacy technical debt that we've incurred for decades. And so we're paying attention to this space and connecting some of the key players, the founders who want to build these solutions, right, to experts, to people who know more about privacy, who have been thinking about discrimination when it comes to privacy, as Carlos was mentioning, because it's not just privacy for the sake of privacy. There are serious ramifications to infringing privacy, as the other speakers have covered. We've also explored in previous events how privacy tech can counter dark patterns. There's some amazing research coming out of Oxford on that, and how we could, build fairer, more ethical systems to counter the status quo. So instead of waiting for policymakers to do what they should be doing, we thought, why don't we guide the folks who are building counter solutions to the more privacy invasive technologies that are in the status quo, that's proliferated, and help fuel privacy tech solutions that can help solve some of our privacy problems today.
Totally, and Lucy, sorry for keeping you on the sidelines for so long here, but I just wanted to switch gears a little bit and talk about your use case with your company, Remedy. You're coming at this from a kind of the other angle from all the other folks. Your business enables some really incredible use cases for telemedicine and remote patient monitoring, which is obviously highly sensitive information that's being transmitted there. So, we've seen with the pandemic, those tools are just so important. They're important not just for the everyday person who's just trying to socially distance and reduce their unneeded face-to-face healthcare visits, which I think a lot of us are, but for some people those healthcare visits are literally life-threatening depending on the conditions that they have that they're bringing in. So like I said, it's a very important use case, and naturally you're handling very sensitive information at the same time. So I just wanted to give you a chance to maybe talk through how you guys approach data security, how you keep that secure, and maybe deal with any trust issues that could arise.
Sure. Yeah, and as you said, I mean, this, health tech and the adoption of telemedicine and remote access to care, accelerated during the pandemic, and can really be incredibly important to medically underserved communities who have a more difficult time accessing healthcare. So I think there's a lot of promise there, right? That a lot of us are trying to enable of different ways to access healthcare for people who face barriers, whether it's transportation or cost or childcare or whatever it may be. But at the same time, being really aware of the privacy concerns that are, tend to drive distrust with the healthcare system and use of this kind of technology. And actually today, the white paper that we've been working on between the App Association and the Consumer Technology Association actually came out today on advancing health equity through technology and raising the issues around concerns within health technology. And, a couple of them have been referenced here, the use of AI in healthcare. Well, what are the training data sets for those AI algorithms that are interpreting data, that are interpreting speech, right? There's been a huge push in terms of productivity in healthcare to use AI-enabled scribes. So, the doctors love this thought. What if, Alexa could just listen to the encounter that you have with your patient and could write your note while you're with the patient, and then you don't have to write the note after the encounter. And that sounds great, right? Doctors hate documenting in their electronic health record, but that is so fraught with privacy concerns, as well as just, data inaccuracy. I was recently traveling in Spain, and there was a headline in the newspaper that a young woman who had seen her OBGYN and had disclosed that she identified as homosexual, and that was put in the chief complaint, not the diagnostic field. So when she got the record of her medical visit, the chief complaint was homosexuality. And so that's a human error that the clinician did that. And if, a human can do that, an algorithm can do that too, right? And it was just a good example of, how fraught this space is. So, so back to your question of, as a company that builds technology, the general understanding of privacy in healthcare, whether it's on the healthcare provider side or on the consumer side, is so poor of what is regulated by whom, and we all think of HIPAA as the sort of general, regulation around health privacy. And one of the big problems is technology that now enables consumers to download their health records to their phone, right? You can do this on your iPhone. If you have a healthcare provider that uses Epic or a lot of the other large entities, that data is no longer protected by HIPAA. Once you download that to your phone, all bets are off. And, the FTC oversees some of that, but sort of the general understanding that I think all of us as consumers have of the fine print that we sign when we go to the doctor every year, you have to sign a HIPAA policy, what that actually means is really, really confusing. So, our efforts, both through the HEAL working group, as well as, at our company is, how can we make that all more understandable? And for, vulnerable and medically underserved communities, that bar is a lot higher because there's a health literacy challenge. There may be a data literacy challenge. There may be a general literacy challenge. And how do we write privacy policies and privacy practices that people can actually understand what they're consenting to?
Totally, yeah. I think that kind of completes the cycle from all of our panelists here, where we kind of all.
I want to weigh in on that for a second.
Oh yeah, go ahead. Sorry.
Lucy, one of the things that I think has become apparent is kind of like the definition of health data, I think, needs to change, right? Like a lot of the work that we do, people overestimate what HIPAA covers and underestimate what health data is. So when you ask people, they think that a lot of the stuff that's not covered by HIPAA is covered by HIPAA. Just because they went to the doctor and the information was given to the doctor, they feel like all of that information is covered through whatever path it takes, which is a huge error. I think health data now has to be defined in a different way instead of covered entities. So for example, geolocation data, where someone's going to the same clinic every week, if they're going to an HIV clinic, that should be considered health data. A search engine results for specific medications or for a specific condition is not something that's covered now. And there's a lot of apps like, social media apps or dating apps that may ask questions about your health. Grindr is a gay dating app similar to Tinder, where you can actually post your HIV status so that people know how to match that. And that's not protected by HIPAA, and people kind of give this information away without knowing. So from our perspective, that is very concerning. And the definition of what health data is, I think, has to evolve with the apps and with all of the devices that have come out that are no longer covered by what we traditionally would think of as health data under HIPAA.
And Matt, this goes into like the big, Lucy and Carlos are highlighting one of the problems that we have that you guys are dealing with in DC, right? Which is the lack of a comprehensive data privacy framework in the United States, whereas like the rest of the world we've had the EU and even China has beat us to one deal with a more comprehensive approach to privacy, as opposed to the sectoral approach that we have, where only a limited amount of health data that falls under the definition of PHI is regulated. If we took more of a comprehensive approach when it comes to privacy versus the sectoral approach that we have today and the state-by-state approach that follows that, we'd have more protections for everyone and not have to worry about loopholes, about certain things not falling under the regulations definition of PHI. And so thank you for you guys for doing that work, informing policymakers about, what we should be doing when it comes to finally passing a comprehensive privacy framework.
No, thank you. And Lucy, looked like you maybe wanted to weigh in on something Carlos was saying a second ago.
Well, just this idea of, the expanded healthcare data set, right? And I think it's the same thing Lourdes is getting at too. Like, we need national privacy guidelines, but we also need to look at this definition of PHI and sort of this whole concept of, HIPAA and who's the covered entity and who cascades under that is so poorly formulated and so confusing to the people who were trying to do the right thing. I mean, it comes up several times a week in my day-to-day existence of, as you said, because of sort of the app economy, because of interoperability of data and acceleration of, innovation in the space is all great. But now there's this much broader sort of network of data sharing that is happening. And the people who are in that network don't always understand sort of where they fall under the HIPAA umbrella, even if they have the best intentions, and that there is data that's very, very sensitive that may not be prescriptively covered under HIPAA, but which they need to protect with the same level of encryption and everything else. So I just think the lack of clarity on this, and probably it reminds Lourdes, I commend your efforts of there need to be there needs to be alignment in the corporate world of all of us just to say that we're going to do the right thing and not wait for the federal government to necessarily regulate this. And so I think that's part of this guidance of, the HEAL working group was 50 companies coming together and saying, what are the problems and what do we all think is the right thing to do that we can at least start working towards and not wait to be legislated.
Yeah, Lucy, and if feel free to expand on HEAL working group. I think that's an important topic to cover. If you could talk about any of the findings or anything that you guys work through with that.
Sure, happy to. So, there were a couple of different areas. So it's the Health Equity Access Leadership Coalition. And again, companies in the private sector, as well as participation from the government, saying in the, health tech sector, what do we think are the issues around how technology can help address equity in healthcare, but also the pitfalls of this. And, how do we not repeat in the technology sector what we have all witnessed during the pandemic in the physical healthcare sector, that we have these tremendous inequities in access to healthcare and outcomes in healthcare, as we saw, evidenced by COVID. So the key areas, one was privacy, and really privacy concerns being a main driver of lack of adoption of technology or lack of access to technology. And so how do we overcome those privacy concerns, both in design of technology, but also in the way that privacy policies are written and communicated, and how products are rolled out. Another was around AI, right? So really looking at data sets and algorithm development and diversity in those data sets, and that being a major concern. And then this issue of literacy, digital literacy and health literacy. So that's, accessible through the Consumer Technology Association, rolled it out. And I'm sure ACT has it up on their website somewhere today as well.
Yeah, and we can make sure that everyone in the audience gets a copy of that as well. Seeing as we have about 10 minutes left, I just wanted to ask one final question on my end, and then open it up for the audience Q&A. And that would just to be to kind of use this opportunity to allow the panelists to share any additional resources for folks who might want to learn more about these issues and get involved. And so if anyone else is working on anything that they want to share, feel free to use this opportunity to plug, or if you have a go-to spot to kind of get educated on these issues, now is the time. And then if not, maybe just wanting to end on a positive note, if anyone could maybe surface anything that they've been working on from a problem-solving angle, one thing that's maybe making you more optimistic about the state of things, if you could share that. So if we could just go down the line, let's start with Kentrell.
So sorry, really quickly before that, I just want to say I thanks to everyone for their comments. I feel like I learned some stuff during this panel, but also regarding the voice usage in prisons, like Carlos and Lucy were talking about. There are health applications as well in prisons where they try to use characteristics of people's voice and words, they say, to determine if they're going to be on suicide watch or not, right? And there's just more potential for AI that is intended to use to help people. It's supposed to be potentially harming them. But in terms of stuff that gives me optimism, there was a jail in Dallas County like a year or two ago that was going to cancel all in-person visits and switch to using video visitation only as a part of their contract with one of these companies. And local activists and organizers went to the county and fought against this and prevented that from actually happening. So for one thing that gives me hope is the potential of organizations, many of like the ones that some of the panelists are on, to organize and stop negative policy changes, but also to propose positive ones.
That's a good one. Lourdes, to you.
I'm really optimistic. I think everyone has a role to play. The policymakers can do their job, hopefully, finally, to pass comprehensive federal privacy law. Industry can come together to, a level down, come together to come up with standards that are interoperable. Consumers can use their voice and their purchase power to go for privacy designed and engineered technologies. And within the privacy tech space where I focus now, I'm really optimistic that privacy tech founders and some investors that are forward thinking and consumer advocates for the first time in history all agree with privacy experts that we need privacy designed technologies to address the privacy technical debt that we've created for decades. So there's a ton of research, from peer research, from consumer reports that demonstrates the clear marketplace demand for privacy. And I'm really excited that more and more people are coming together to work on this.
Yeah, I agree. There's so much work out there these days that's exciting. Carlos.
Sure. I want to plug lgbttech.org, our organizational website. That's where we do a lot of blogs and a lot of the research that we do. You'll find on there. Also, our Power On program, which provides technology to LGBTQ centers across the country, serving underserved and marginalized populations. We give technology to centers so that they can give it to populations, serving 54 centers across 31 states. So that's my plug. The optimistic thing, I think the one thing I can think of, and it's very current, is the Facebook decision to shut down its facial recognition program. And this, to me, is a great victory for privacy. A lot of companies, I think Amazon has put a moratorium on providing facial recognition technology to police departments. Microsoft did as well, and IBM. And this is kind of showing the power of civil society and privacy advocates having these conversations and corporations listening. Absent regulations, which are sorely needed to kind of regulate facial recognition and other AI technologies. When you see a company like Facebook, which arguably has the largest facial recognition database in the world, taking a step back for privacy, and all of these other companies, because of pressure from privacy advocates, it gives me optimism that, with the right message, privacy advocates and corporations can work together to kind of help make some more privacy positive changes across the technology.
Definitely. Not wanting to rain on the parade, though, I did have a major facepalm today when I saw that Facebook was not applying the facial recognition ban to the Meta.
Facebook app, right?
Yeah, that was quite a turn of face, and maybe slightly disappointing. But I do agree that having 4 or 5 of the biggest companies in the world who are focusing on facial recognition, either stalling it in one part of their business or agreeing not to sell it to law enforcement or just going on full-fledged moratoriums, I think is definitely a positive development. I agree. And then Lucy, rounding us out.
So I will plug that I did put the HEAL working group paper in the chat for anybody who wants to download that. A lot of good information there and input from some really great organizations. I think what makes me optimistic is the conversation that we are having about privacy and trust in healthcare, and the fact that, we've all had to confront this reality during the pandemic, and specifically with the vaccine and treatments, that there's immense distrust of our healthcare community. And it's not a conversation we've wanted to have because that's really hard to hear as somebody who, in part of my life was part of that healthcare community. What do you mean you don't trust your doctor? You don't trust the health system? We're all here to help you. And it's a history and a past that I think people haven't wanted to talk about. And this has really forced us to have the conversation, right? Trying to convince people to, believe the science around COVID and to get the vaccine has forced some really hard conversations within the industry and really important conversations with individuals and consumers that I think is going to help us in a much broader fashion than just with COVID. So I'm in a strange way, I feel optimistic because of what we've been forced to confront over the past 18 months.
Well, I'm happy that everyone seemed to have a fairly easy time finding something to be optimistic about. I know these discussions can sometimes feel like they're dragging you down in the muck. So thanks everyone for that. I just am monitoring the Q&A for any audience questions, and it looks like one just popped in. I can read it. Do any of the panelists have thoughts about the intersection of privacy and immigration? Yeah, that's a kind of sub issue that's speaking to people who are really especially at risk, maybe due to their legal status. So if anyone's, Carlos, I think I maybe saw that LGBT Tech did some recent work around immigrant privacy. If you want to share.
Yeah, I mean, similar to what Kentrell's been talking about, this is another population that is, very subject and very vulnerable to abuse and to tactics of pressure. So when we talk about encryption, immigrant populations is one of the populations we're talking about in terms of being able to communicate freely, and the value and the kind of the essential importance of encryption and encrypted communications, so that immigrant populations can speak to counselors, they can speak to advisors, they can speak to lawyers without feeling overheard. It doesn't require the state to overhear you to have a dampening effect on your speech. It just requires the thought that it might be able to hear you to completely dampen your speech. So it is important for technology to serve those communities as well, and provide a means for immigrants and other oppressed communities to be able to have these conversations freely without thinking that they may have overheard. Like Kentrell mentioned, the reason that you can't really rely on personal conversations is because you don't know who's hearing and how that impacts the conversation you're having. Similar with immigrant population. So the importance of technology for these communities cannot be overstated.
Sure. And is there any platforms or anything that you can recommend for folks if they're looking to go with the most privacy protective solution, or are you not allowed to kind of hawk certain products or services?
I think Signal is definitely one of the ones that stands out as a gold standard in privacy for these kind of conversations. I don't want to go into a lot more other ones, but I think Signal is what you would start with as you search for these kind of apps.
Yeah, no, that's helpful. Well, seeing as doesn't look like we have any more questions in the Q&A, and we just hit 5:30, I just want to thank everyone again for their participation on the panel, and thank you for everyone watching at home as well. I think this recording will go up on our YouTube channel shortly, so if anyone had to drop in and drop out, you'll be able to see the full thing in the next couple of days. But aside from that, thanks again, everyone, and have a good afternoon.